Of introduction, hello and welcome to the Bernalillo County District 5 Behavioral Health Town Hall. My name is Charlene Pyskoty and I am the Commissioner for District 5, as well as the Vice Chair of the Bernalillo County Board of Commissioners. In addition, I'm a licensed mental health therapist. And so I am so pleased to host this event. This is the first behavioral health town hall for constituents in my district. And I want to thank my constituents for submitting their questions prior to this meeting, as it has helped us customize this presentation to answer a majority of your questions. I know that people have a lot of questions, things related to behavioral health, homelessness, substance abuse, and how all those things tie into public safety, how people can access services. So I know, Margarita, that you'll be touching on probably all of those topics. So I'm really looking forward to this presentation. I know there's a lot of things that Bernalillo County is doing in the area of behavioral health. And so I know you're going to answer so many of those questions tonight. So now it's my honor to introduce everyone to the Director of Bernalillo County's Behavioral Health Services, Margarita Chavez Sanchez. Thank you, Margarita. Take it away.
Thank you so much, Commissioner. Good afternoon, everyone. Thank you so much for joining us. As Commissioner mentioned, we have embedded a number of questions that were submitted ahead of time into this presentation. But the intent of this town hall is to not only provide an update on everything that we're doing, but also a platform and a venue for those questions to be asked and answered. And so I just want to quickly mention that there is an opportunity to ask questions via the Facebook Live chat. Once I complete the presentation, we'll go through and answer more of those questions. I will say, if you have questions already, pause and see if I am able to answer them in the presentation itself. And if things still are jumping out to you, by all means, please feel free to chat and provide those questions to us. Joe Noriega and Evan Gonzalez will help us to navigate those questions when we come to the end of our presentation. So bear with me just 1 second so I can share my screen and we'll jump right into the presentation. All right, can everybody see that? Well, it's thinking. Stand by. All right, Commissioner, since you're the only one I can see, can you give me a head nod if you can see my slides? Yes, okay, great. All right, so many of you are aware of the process that brought us to where we are today, but I'll give an overview of that information because I feel like it's important to understand that process in order to really know where we were and where we've gone and how we are where we are now. And so in 2014, a question was taken through a ballot to the community and asked voters if they'd be willing to tax themselves. The county commission at the time felt that it was important to ask the voters this question as opposed to just imposing a tax. And so this ballot question asked folks again if they would be willing to tax themselves 1/8 cent gross receipt to be dedicated to behavioral health services for children and adults that are not otherwise funded. The not otherwise funded is really important to mention because we do everything we can to leverage these dollars as far as we possibly can. So for example, if something is funded through Medicaid, even if it's underfunded, if it's funded through Medicaid, these gross receipts tax dollars are not dedicated to that, to the funding of that project, right? Because there's another funding source available. So we want to fill the gaps where there is no funding available. So upon the overwhelming majority support for that ballot question and support for implementation of this tax, the tax begun to be collected in 2015. At that time, the county solicited the help of Community Partners, Inc. as a consultant to develop a business plan and a roadmap for the Behavioral Health Initiative. The Behavioral Health Initiative was born as a function of gap analysis, needs assessments, and work that was done with many community partners, stakeholders, and organizations. And in the development of the Behavioral Health Initiative, it was identified that there were 4 main focus areas that we should really center our focus and our attention on. Those focus areas were crisis services, community supports, supportive housing, prevention, intervention, and harm reduction. Now, in order to really ensure that we had meaningful community input, a subcommittee was developed amongst each of those 4 focus areas. Those subcommittees are built of people with lived experience, family members, technical advisors, and subject matter experts in the area of behavioral health. And again, it was really important that we do something different besides just allowing the community to make public comment at a county commission meeting or send an email to a commissioner, but have true meaningful input in a way that they can craft and tailor the projects and the funding that was dedicated to these programs and projects in the community. So those committees still remain in place. And in order to ensure that we didn't have 4 siloed committees, we created a steering committee. That steering committee is built of the chair and vice chair of each of these 4 subcommittees, and they meet monthly in order to ensure that housing knows what community support is doing, and community supports knows what crisis services is doing, because we recognize that it's a continuum of care, and there is a significant amount of overlap in each one of these areas. Now, the ABCGC became the platform for which we were able to join forces with the city of Albuquerque in all of the work that we were doing. This actually begun under the leadership of Mayor Berry, and it really gave an opportunity for he and his team to work with our team on the county side to find ways that the city could also leverage what they're doing to navigate the gaps in the community. We continue to bring any of our proposed funded projects through the ABCGC, or the Albuquerque Bernalillo County Governing Commission. And that again is a platform for which the city, the county, and the mayor's office, and now an addition of APS School Board, can hear the work that we're doing and really understand how it's working to address the gaps in the community. I will mention that the intent to really bring in the ABCGC is to have also not just Behavioral Health Initiative or BHI gross receipts tax dollar funded projects through the ABCGC, but also projects that are funded through city dollars to come through that venue as well. The next piece on this trajectory that we're looking at right now is the county commission and the city council. So right now, let's say a project of the mobile crisis teams, right? That's one that's really important that people know a lot about. That goes through the crisis services committee. It then goes to the steering committee and the ABCGC. Since that project would be funded by gross receipts tax, that component will go to the county commission for official appropriation of those dollars, as the county gross receipts dollars do again filter through the county commission side. If there is funding on the city side, it will then respectively go through the mayor's office or the city council. So always kind of lead with this trajectory and this slide, because I feel like it's really important to know kind of the vetting process that all of our projects have gone through and continue to go through. These committees remain in place while we don't have necessarily a lot of new projects that are coming through because a lot of the funding is expended. These committees still meet on a quarterly basis. There's actually a meeting right now happening with community sports and supportive housing to talk about the Community Connections Project and really learn about where it's been and how should we look at expanding, look at data that's been collected. And so that community input and that vetting process is not exclusive to just getting projects started, but we want to have that continued impact because we feel that the value of that community input, it should be seen throughout the entire behavioral health initiative. So these are some really busy slides, but I always add these because I feel like they're important to look at the scope of the work that we've been doing and the amount of projects that are currently funded. I have more detailed slides forward in the presentation that talk about each of these projects, but this gives a snapshot of some of the projects that are vetted to date. Some of these are pending or not in place right now, but they have been approved and moved forward. But this gives you, again, another snapshot. I'll move to the next slide of the projects that have been funded through the gross receipts tax. So I'd like to just lead with services that are not necessarily funded through the gross receipts tax, but I feel like they're really important. We have services on the CARE campus. Many of you may have known the CARE campus previously as the MATS campus, but we have done a rebranding and a renaming, and we are now the CARE campus. And a few reasons why we changed that name. The first is that we feel that now we are providing comprehensive care and additional services beyond just substance use services that the campus has provided for many years. We've added crisis stabilization. We'll be adding an outpatient behavioral health clinic and living room model services on that campus. So again, it is more of a comprehensive care versus the MATS campus or Metropolitan Assessment and Treatment Center. And so again, we want to really provide one-stop shop robust services on that campus. The services that we're currently providing on that campus is our PIP program. It's our Public Inebriate Intervention Program. This is sobering services for people to either self-report or be brought by first responders for public intoxication, and they can come and stay the night with us. We provide food and hydration and monitoring overnight, and then in the morning we connect these clients to support services and offer them detox if that's something that they're interested in. So this is on the lower end of the harm reduction continuum for folks that maybe are not necessarily ready to access detox or continued supports, but are needing sobering services, and it's not necessarily appropriate for them to go to an ER or to be sleeping on the street corner. I really want to emphasize that this is not an intent to provide shelter services. It is absolutely for people who are publicly intoxicated and needing that support. So while it does provide shelter, it's not just like a homeless shelter that we're operating overnight. It is providing sobering services. So there is essentially an eligibility criteria that folks need to have been intoxicated to access the services. We also provide our social model detox program. This is a 10-day social model detox program. Clients can come to us detoxing from any substance. Our most common substance that comes to our campus is alcohol, followed by opiates, and quickly approaching that list, the top of that list is methamphetamines. And so most of our clients are polysubstance. They come in with multiple addictions, and they work in our social model detox program. Again, they can stay with us for up to 10 days. We have robust case management in that program, and so anyone who comes to our social model detox or our PIT program can be connected with the case manager to connect them to continued services. We encourage all of our clients who complete our detox to be plugged into another long-term service, and again, that is a part of that larger continuum. It's not uncommon that our clients come to us multiple times. They come into detox multiple times, and eventually they are ready to connect to that long-term services, but we want to be able to make sure that we have a level of availability along the continuum to meet clients where they are in their stages of change and their readiness to access that help. Within our social model detox program, we're contracting with the University of New Mexico Hospital, who operates our MO2 clinic. It's our medical observation and treatment unit. That clinic, again, is run by the University of New Mexico Hospital. Our medical director is Dr. Yolanda Morales, and she has a team of advanced practice providers, our nurse practitioners, who work in that social model detox MO2 clinic, and they actually are providing MAT. So we've started MAT this year, and that MAT right now is Suboxone, and so we've been having a great success with clients coming in and being connected on Suboxone. The eligibility criteria for receiving Suboxone is based on the provider evaluation and the client's willingness to access that service and maintain care. We, again, are providing that induction and using Suboxone for detox on our campus. Anyone who's interested in induction, we work to connect them with a long-term treatment provider in the community. And so while they're getting their induction from us, we're connecting them to the supportive service in the community. We have a case manager who's dedicated to that and ensuring that they are connected for that maintenance in the community. Our supportive aftercare program is our on-site residential treatment program that is very similar to sober living. We have a program, the SAC program, that it allows a client to stay with us for up to 30 weeks or 6 months. They advance through phases of the program, and in advancing through those phases of the program, it allows them to navigate their journey in sobriety. The goal at the end is for them to be housed, for them to be employed or in school. And so our care coordinators begin working with them on day one to strive for those goals. We use the community reinforcement approach to provide behavioral health programming for these clients, and again, really work with them to connect them to continued services. We partner with the University of New Mexico for the Milagro and Mariposa program. This is for women who are pregnant or postpartum who have an addiction. They come to us as a part of our supportive aftercare program. We provide the residential services and the behavioral health services on site through our CRA and programming and case management services. And they receive all of their clinical care from the UNM Milagro program, both prenatal and postnatal, and pediatric care for babies after they've been born. The newest component on our care campus is our crisis stabilization unit. Our crisis stabilization unit is currently being operated. The stabilization unit is licensed as a crisis triage center, but we're providing crisis stabilization services as opposed to crisis triage because we feel like there is a significant need for continued stabilization. So if somebody goes to an emergency room and they take their loved one there for behavioral health, and they go to psych emergency and they go to the ER and the providers do an evaluation and an assessment, and they say, yeah, they're having some issues, but they're not quite sick enough for inpatient. But the family feels, or even the provider feels, they're not exactly stable enough to just go home and manage their episode in that moment. And so crisis stabilization is that stopgap in between needing inpatient admission and just kind of going home. So they can come and stay with us at the crisis stabilization unit for up to 2 weeks. We can have a max of 16 clients in that unit based on federal regulations. And again, we're really excited to have this program in place. We're currently receiving clients to this program through referrals. And the goal is eventually for us to be able to receive clients who walk up to the door and are appropriate for that crisis stabilization unit. Another piece that's really important to mention is that the county has appropriated actually $30 million for a crisis triage center and a partnership with University of New Mexico Hospital. Now, $20 million of that $30 million is dedicated to a capital investment, which has been matched by the University of New Mexico Hospital. So it is a total $40 million capital investment in a crisis triage center. The additional $10 million that is in the county $30 million will be dedicated to crisis services as a function of the CTC and continuing services for crisis along the crisis continuum. Again, that's both the 20 and the 10, so the total 30 is one-time dollars that the county is expending. Again, that is for crisis triage on the UNM footprint. A piece that I didn't include on the slide, but I want to mention, we've also appropriated $4 million to the care campus for renovation and expansion. We are expanding our services on the care campus. Our social model detox program currently provides services to 48 clients at any one given time, and our PIP program is a max of 20. With the expansion on the care campus, we will be launching an observation unit, an observation and assessment unit. PIP will become part of that unit, and that will take up to 60 clients. So we will be significantly increasing the amount of clients that we can serve in observation and assessment. And we will be also adding an outpatient behavioral health clinic and a living room model service on the care campus. So again, the living room model service is going to be something that's going to be peer driven, and people can drop in and access services and have a conversation with the peer, meet with a case manager. The outpatient behavioral health clinic will provide clinical behavioral health services, including MAT, to the community at large, and our observation and assessment unit will be allowing to expand the capacity for PIP, and how PIP right now is specifically focusing on substance, but observation and assessments will also allow people who are just needing short-term observation for behavioral health services to be to come to the campus to access that care as well. So I'm going to jump into the programs right now that we're funding through the Behavioral Health Initiative. I don't want to just read these slides to you because I hate when presenters just read the slides. So I'm going to speak freely, and again, at any time we'll have the we'll we'll go through those questions at the end. If there's more questions, please jot them down and we'll address those. So our mobile crisis teams, again, is a program that's been in place for some time. These mobile crisis teams are built from 4 APD teams. Sorry, there's an error there. It says APS and it should be APD. 4 APD teams, 2 BCSO teams, and we will be expanding to 2 non-law enforcement teams with Bernalillo County Fire Department. So this pairs right now a law enforcement officer or deputy with a master's level behavioral health clinician to respond to 911 behavioral health calls. And the intent behind this was to really bring a behavioral health clinician to the scene as opposed to it just being exclusively a law enforcement response. The county recognized that we needed to make this shift, and this was one of our first programs to be funded. That being said, we've recognized that it does not always require a law enforcement officer to participate in that response. So we are adding the non-law enforcement teams and working with Bernalillo County Fire Department to expand our mobile crisis team response, but have a non-law enforcement component. So our Transition Planning and Resource Reentry Center is really an innovative program that starts at the jail. So in the Metropolitan Detention Center, everybody who goes into the jail gets a receiving screening. That receiving screening looks at risks to recidivism. It looks at behavioral health or mental health and substance use disorders. It looks at suicidality. It adds the Columbia Suicide Scale in there. And in that receiving screening, they are looking at clients' risk scale. And so based on that risk scale, teams are then deployed to work with clients in the jail. So let's say I get booked into the jail, they do a receiving screening, and I score high on that receiving screening. Once I score high, the transition planning team, who is actually a representative from UNM is our provider right now, will be deployed to work with me. So while I'm in a pod, they immediately begin working with me and develop a transition plan so that I can be connected to services upon my release. Now, it's really important to recognize that this model, it's phenomenal. But the critical part is that many clients that go into the jail are in and out in a quick amount of time, right? In like 48 hours. And so sometimes that's not enough time for a transition planner to really work with them in a comprehensive way and have a detailed plan for which they can implement when they leave. And so on the back end, we need to make sure that we catch those folks and engage with them and help them get connected to services. Hence our Resource Reentry Center. Our Resource Reentry Center is at the old Public Safety Center at 401 Roma. And prior to this opening, when people were released from MDC, they were taken to the corner of 4th and Roma, the back of a bus opened, and people just scattered without any ability to connect to resources. And sometimes that happened in the middle of the night. And so a number of these concerns and concerned constituents came to the county commission, and the county commission said we need to do something. And so the Resource Reentry Center was opened. It is open 24/7, 365. We have had a little bit of change and shift on account of COVID, and had to make some changes on hours and things like that. But again, the Resource Reentry Center is something that is available always to newly releasing citizens. That Resource Reentry Center is staffed with county case managers, and some transition planners that are at the Resource Reentry Center. And again, the intention is to work with folks who maybe are either high on that list and really need a robust transition plan, or somebody who just says, hey, I just need to charge my phone so that I can call a ride. So we have resources like coffee and sandwiches and phone charging stations. But what we really want to do is allow the time that someone is charging their phone to be an opportunity for a case manager to sit down and say, hey, how's it going? Do you have a plan? Do you have somewhere to stay? How can we really help you get connected to those services? We partner with pretrial services and other supports in the community to make sure that people are showing up to their pretrial hearings, and again, working with those clients to meet the needs that they have. The Resource Reentry Center just published an annual report, which is great information if that's something that you're interested in, more details on this project. It is on our county website. Our Adverse Childhood Experiences project, this is also one of our first funded programs through the Behavioral Health Initiative. We have a number of providers who are our adverse childhood experience providers. These contracts are going to be ending soon, and so we are working with the University of New Mexico Institute for Social Research to conduct evaluation on our ACE projects and all of our projects, actually, because we want data to inform how things move forward. And that data, again, will inform either execution of new contracts or solicitation of an RFP for new providers to address adverse childhood experiences. We've also invested in training and education. Training and education is $1 million investment per year for 3 years. So a total $3 million non-recurring investment. And so we have a couple of providers who are listed here, and they're all providing training. The benefit to COVID is that these trainings have become virtual, and so it's been a lot easier for folks to access these trainings now. So everyone on the line and anybody who's watching this later, please go to our website so that you can look at these trainings. They are free to the public. The county, again, is covering the costs and contracting with these providers. Many of these services are extremely valuable, not only to people who are working in the behavioral health field, but if by nature of your employment or the area that you live in, you're engaging with the behavioral health population, it's really important to recognize that sometimes just training and education is the start, right? How do I learn more about interacting with this population? We also are funding suicide prevention. We know it's been published recently that New Mexico is at the top of the charts for suicidality and complete suicide here in New Mexico. And so we've made $1 million investment, annual recurring investment in suicide prevention. We're currently working with APS, First Nations and Centro Savila. As you can imagine, the APS program has had to shift slightly as APS has gone virtual, and we're continuing to work with them to get these needed services to the student so that we can intervene and help prevent suicide. So some peer-based services that are currently in place, we have our peer support drop-in centers and our peer case management that is currently being funded. We believe here in Bernalillo County that the value of a peer is phenomenal, right? A peer working with someone and can speak to their lived experience is very different, right? Sometimes a clinical intervention is necessary, but sometimes a peer intervention, many clients can engage better with a peer in that way if they feel comfortable and can share like experiences. We also know that we have a provider shortage here in New Mexico, across the country, actually. But New Mexico, again, is at the top of the list of provider shortages. And so maximizing and leveraging peer supports whenever we can is really important. We're currently work with Albuquerque for Center Hope and Recovery and New Day for our peer support drop-in centers, and our peer case management providers is Centro Savila and Crossroads for Women. So sorry, there's one more arrow there, but we also have Crossroads for Women as a provider in our peer case management. Our law enforcement assisted diversion, this is a piece that is really important because I think there was a couple of questions that are answered by one of these slides here. And a law enforcement assisted diversion program, or our LEAD program, is a public safety program in which law enforcement officers can engage clients who maybe they would have traditionally arrested and allow them to get connected to behavioral health services and access treatment. So this is a partnership with a number of entities, including the district attorney, the public defender's office, the city and the county, and others, to really find a way to divert people away from the criminal justice system and into treatment. So it allows an officer to use their discretionary authority to divert someone who is appropriate and meets criteria. You can see the inclusionary criteria on the screen, but allow somebody who meets that criteria to be connected to those services as opposed to getting booked. Ultimately, the DA will hold that charge as long as this person gets connected and is maintaining that treatment. So again, this LEAD program has been really phenomenal. We're continuing to work with APD and BCSO to provide more referrals. The case managers are housed by the Department of Behavioral Health Services, and so they come to us, or our case managers go to them to get the clients connected. We're also funding youth transitional living services. Again, we have 4 providers in this program: Casa Q, YDI, A New Day, and Serenity Mesa. These services are for youth in their transition ages and helping them get connected to services and providing services so that they can be successful. It's not uncommon for this to be youth who are aging out of foster care, or what we see a lot with Casa Q is LGBTQ youth who maybe have been kicked out by their family and not really sure how to navigate the system. And so this funding component and this project really work to provide the supports and the services that these youth need. Our community connection supportive housing, right? Housing was another big ticket piece that we received in our questions. And so in the county, we've worked to really fund a continuum of housing supports. Our community connection supportive housing project looks at people who are homeless or precariously housed, which is really important piece. Precariously housed means that they could have been couch surfing, or maybe they've been sheltered, or they've been in jail. According to the HUD definition, it's really restrictive on who can access HUD-funded supports. And so our community connection supportive housing target population opened that definition of homelessness so that we could serve more people. Right now, it's collaboration with the city of Albuquerque. The county provides $2.7 million annually, and it is intended to fund up to 300 scattered site vouchers. Again, it's really important that we mention that this is a scattered site component, and so this is for clients who have the ability to live independently in a scattered site model with some supports. So they're paired with a case manager, and that case manager works with them regularly, including a minimum of weekly check-ins, twice a month at least, site visits. I'm sorry, my dog wants to be on camera too, I think. But again, I think it's really important to just mention that these clients can live independently with some of those supports. And moving to the next slide, I want to talk about our single site multifamily housing unit, and I want to talk about our single site supportive housing unit partnership with the city. Now, our single site model is built to work with folks who maybe can't be successful in a single site model. We know that if someone is having an innate behavioral health needs and they live in a single site model, it may be difficult for them to access getting to a place where they can get supports for their mental health needs. And so a single site model essentially puts the whole first floor as behavioral health services. So all these residents have to do is walk downstairs to access those supports. So these are going to be for a higher acuity of clients. And again, it's providing the on-site behavioral health services. There will be 24/7 peer supports at a front desk where people can go downstairs in the middle of the night and say, hey, I don't know what's going on, maybe I'm hearing voices, and that peer can work with them or contact a higher level of care to help them access those services quickly. Really excited about this. This is something that the county is invested $8 million of capital. Right now, we're looking at a site on 6th and Cole. We will look to purchase and build in that, and then we will be contracting with the provider to provide the behavioral health services. Now, this is the single site supportive housing unit. This is a collaboration with the city. The county put in $2 million of recurring dollars. That's a $2 million capital investment. The city also put in $2 million of non-recurring capital investment, so a total $4 million capital investment. And the county put out the $1 million of recurring dollars for this program. We issued RFP, and that the city issued the capital RFP, and St. Martin's and Yes Housing was awarded that. The county put out a service RFP, and that was awarded also to St. Martin's. It's our understanding that the $1 million will be providing some of those operational dollars, but they'll be leveraging other funding sources for operations like Medicaid billing as well. I mentioned earlier that we work with the UNM Institute for Social Research. The UNM Institute for Social Research is embedded in all of our programs. And so it's really important that data informs what we do. And so there is evaluations of our projects that are in place right now. They pursue IRB approval in order to conduct a formal evaluations. And they work with us on performance metrics and ensuring that the providers are collecting the appropriate data so that we have meaningful data for which we can move forward on projects. Many of their existing reports are on our county website, and we are expecting more to come. And again, it's really important that we're transparent with that. So we always post them on our website as soon as they are public and complete. So we have our capital and startup RFP that was issued. It was a $10 million investment. That is currently in the RFP process. There was 67 submissions, and we've selected 12 candidates that we're moving forward into negotiations. Really excited about this one and hoping to announce that. There was a question about who is funded and when that's going to be announced. Unfortunately, we're bound by the RFP process, and I can assure you that I'm constantly pushing that this happens sooner rather than later. It's taken a long time, as you can imagine, with COVID and a number of intricacies that are requiring legal review, but excited and hoping to announce this one shortly. We want to talk about the COVID impact on the behavioral health gross receipts revenue. Prior to COVID, and so in the previous fiscal year, we had spent just about up to the total the total amount that the gross receipts receives on an annual basis. Now with COVID, we're predicting that the gross receipts revenue is going to be decreasing significantly. And on account of that, we are going to be pausing on a couple of projects that had been approved but had not been launched yet. So right now, our school-based health centers, peer support services for aging population will be paused. We had an available fund balance of about $750,000 that could have been available for recurring services. That's going to also be paused. And then the reoccurring dollars for both of the single sites will be paused as well. Both of the single sites, we don't see them being in operation this fiscal year, so we don't predict those dollars will be needed, but we have to pause on those as opposed to having to cut existing programs. These programs that have not been launched will be paused. The other bullet on here that should be included is our support of our housing for sex trafficked youth as $1 million investment in a collaboration, one-time $1 million investment in a collaboration with CYFD, which will also be paused on account of shortfalls with CYFD. Now, related to the COVID response, the Department of Behavioral Health Services, also at the recommendation and support of Commissioner Pyskoty, issued a behavioral health CARES grant. That CARES grant went out to the community. We've had a number of behavioral health providers apply for it. We actually reopened it. It should have closed on Monday, and we've decided to extend it to the end of the month because we want to make sure that more providers apply and more people have the opportunity to apply for those dollars. Those are $10,000 grants awarded to behavioral health providers, and we want to maximize getting those dollars into the community. This is going to be to help providers if they need to put COVID precautions in place, or if they've been impacted by COVID by adding telehealth or things like that. Again, it's really important that we support our existing behavioral health providers. We also are funding a motel voucher program through our COVID response, and so we worked closely with the APS McKinney-Vento program and are partnering with families, APS or school-based families who have been unhoused on account of COVID. So let's say they were couch surfing at their Thea or Theo's house, and on account of COVID, aunt and uncle said, hey, you guys are gonna have to find somewhere else to stay because we can't have so many people in the house, or we have these precautions in place. So now they find themselves homeless. And so we provided an up to 3-month motel voucher for these families, and in partnership with the McKinney-Vento program, the case managers and social workers immediately began working with those families because we know these motel vouchers are not permanent. So they began working with those families immediately to identify long-term housing supports. And so I think with the exception of one family, those supports have been found, and that one family that was not able to find kind of those longer-term supports, they were provided with some more short-term supports as well. So again, it is our intention to help in that short term, but we recognize that that's just a Band-Aid, and the response that we need to work with these families is longer. So this is a little bit of us tooting our own horn. We received a couple of awards in this last year through the National Association of County. We received 5 National Achievement Awards, and really excited about this. Our supportive aftercare program was best in category, law enforcement assisted diversion, our Narcan harm reduction program, the CARE Campus. Something I didn't mention is that the CARE Campus is a community distribution site for Narcan. So at any time, anyone in the community can come to the campus and get a Narcan kit and training at no cost. And so it's really exciting. We've also launched needle mapping so that we can get a greater understanding of where people are finding needles in the community. And again, our youth transitional living services was also awarded. So excited about that. And again, just a little opportunity for us to pat ourselves on the back. But I think it's really important to just recognize that what we're doing in Bernalillo County is being recognized on a national platform. So with that, and in an effort to give some more time for questions, there is the department website there. Again, there's annual reports and additional resources and venues to access more information. You can contact me at the Bernco BHI or through our department website. Here is my direct contact information if anybody has more questions to follow up. It's inevitable if I'm on a webinar or something, it's inevitable that half an hour after it's over, I come up with more questions. So if that happens to you, please feel free to shoot them my way or the commissioner's way and she can get them to me. But with that, Commissioner Pyskoty, I will just push it over to you and let's see what questions we have.
Yeah, thank you, Margarita. And I hope people who are watching this live on Facebook to please just put in the comments if you have questions. Evan, I think you've been monitoring those comments and I saw a question in there. Do you want to read that question now? Evan, are you there? Unmute yourself.
I think Commissioner Evan is offline, but I can.
Joe Noriega.
Yeah, I think I have.
Okay, I saw the Bernalillo County seal. I didn't know who was behind there. So, Joe, thank you. And do you want to read that question?
Sure. So the question is, it's from Patrick Byer Smith, and he says, "We are greatly understaffed at the University of New Mexico Hospital for paid staff of certified peer support workers. What plans for expansion of certified peer support workers does Bernalillo County have so that our community can grow in removing the stigma associated with mental health services and substance use treatment services and show recovery is possible?"
Great, thank you, Joe, and thank you, Patrick, for that question. As I mentioned in the presentation, we are strong advocates for peer supports and especially certified peer support workers. We have actually really talked about even expanding our peer supports on the care campus as we are working to provide services through our living room model services. As you mentioned, the University of New Mexico Hospital, we are partnering with psychiatric services to implement living room model services there at the University of New Mexico Hospital, as well as implementing additional supports for peer supports. And so, Patrick, your concern that you're raising here is absolutely on our radar, and we are working closely with UNM and in the county to see ways that we can leverage peer supports even further. Really feel that peer supports have, again, a different value so that we can do that and show that recovery is possible. And not only recovery on the substance-based side, but also recovery in the mental health side and accessing treatment and being able to give back in that way. So Patrick, your question is on our radar and we are on it and working closely with UNM to do everything we can on that side.
Are there any other questions, Joe?
There is not, but well, there was a question from Jennifer, and she said, "Will these slides be available for download? And if so, where can we find them?" And Evan replied and said, "Yes, this presentation will be available for download tomorrow at www.bernco.gov/dbhs under the media gallery." So if anyone wants to review this presentation, you'll be able to find it tomorrow on the Bernalillo County Behavioral Health Services webpage under the media gallery tab.
Yeah, that's a great question. I'm glad that Jennifer asked that question because I'm sure a lot of people want to go back and review the slides and the information. And I know that on that behavioral health webpage, there's a lot of information about our services, about the behavioral health initiative. And so I do encourage people to go. I know as we go through this presentation, it's a lot of information, um, and I think that has been one of the frustrations for me as commissioner, is that people are always asking, how can I find out more about what you're doing? They're just, I think we're just moving at the speed of light with our programs, and doing a good job. As you mentioned, Margarita, that we have been gaining a lot of recognition from other counties, from other states, from other organizations, because we're building such a great portfolio of behavioral health services that really strive to tie into this continuum of care to give people what they need to get up and running on their feet, to live independent, stable, happy lives. That's really our goal. And so, yeah, I hope that people do go and check out the webpage and really, really look at all that information. Any other questions pop up, Joe?
Yeah, we have another one from
Oh, okay.
Maxwell Kaufman, and he says a great number of justice involved people have warrants, many times because of homelessness, disabilities, and/or mental illness, create difficulty in navigating the justice system, especially during COVID. Example, not knowing who to call, when to call, where to show up, how to get there, etc. While warrants present barriers to treatment access and can disrupt the continuum of care, what is Bernalillo County going to do to allow those with warrants to access treatment and encourage re-engagement with the courts? Is the county considering coordinating with the law offices of the public defender to help people resolve warrants to avoid unnecessary bookings into MDC? There are ways for the courts to cancel bench warrants if the client is in communication with counsel and engaging in services.
Great, thank you, Joe. And Maxwell, good to chat with you, because I think we've chatted before. It's been a little while, but absolutely, this is something that's on our radar. We have actually been working with the DA's office and the public defender's office to look at something that is slightly different from the traditional law enforcement assisted diversion program, but a place where we could more do like a social referral, so that a client could be paired with a lead case manager with whom they can work on getting those warrants resolved, so that it's easier for them to access services. And so this, again, is something that we're actively working on. Charlie Verplu is our assistant director, and she is working, again, closely with representatives from the DA and the public defender's office to find ways that even on the care campus, if someone comes to our campus and they have a warrant that maybe would exclude them from accessing the care on our campus, how could we plug them into LEAD so that then LEAD can work with them to get that warrant addressed and plug them back into the supports that they need.
Thanks, Margarita. I'm going to ask a question because it's one of the most common questions that I get, which is, first of all, I want to say that in my district, I love my district. I have the best constituents. Everybody knows that, right? I always go around bragging about my people, but they have really good hearts. And so when they see somebody struggling with maybe homelessness or, mental health issue, they want to know, how can we help that person? So how do they call? And can you talk a little bit about community engagement teams? I know that in my district, in that Central and Tramway area, I will often have people reaching out to me, constituents reaching out saying, there's a homeless camp, and what can you do? How can you help? So can you talk a little bit about how to access help?
Yep. So I think that's a really good question, Commissioner, and thank you for that. I think had 2 items on my radar that I missed, and now that you mentioned that, they helped me remember. everyone knows that the city is working tirelessly to really address kind of the housing and homeless continuum here in Albuquerque and in Bernalillo County. That being said, I know everyone has probably heard of the Gateway Center, and there has been a lot of feedback on that, I guess is the best way to say that. A Homeless Coordinating Council has been developed in order to help address that in a collaborative way that combines the city, the county, and the University of New Mexico to address that approach. Right now, I want to just mention that it is no longer an intent to have a massive 300 to 400 person site that would be a gateway center. I think that was on the table for some time, and that's no longer at the top of the list, if it's on the list at all anymore. They're looking at multiple sites to provide services and provide supports for people who are experiencing homelessness. That being said, I think that's a good segue to get into community engagement teams. Community engagement teams is a service that we have funded in the past. We had some issues with our provider, that contract ended. The provider decided to terminate or end that contract because it wasn't a good fit. They were unclear of what a community engagement team was, and they were providing more just peer supports in the community. So what we're doing now is we have an RFP that's under review and are hoping to award a community engagement provider contract very shortly. But what that does is it's an opportunity for a peer response to folks who are needing supports. And once that is launched, there'll be a number that people can call at any time and say, hey, I have this person in my neighborhood, or I have this person in the park who's talking to himself, or looks like they need help. That community engagement team can respond and engage with those folks. In the short term, what we know is that what's currently being used is the 311, and 311 is deploying supports when appropriate. And again, we're building out this community engagement team component. I will say that the city of Albuquerque, as many of you have seen on the news or in press releases, is developing an ACS division, or a division of assertive community, or no. I think assertive community services. I forget what the acronym stands for, but it is a division of family, outside of family and community services, that provides supports for folks who are experiencing homelessness or having behavioral health needs, but it's pulling it away from the law enforcement model. So we work closely with them. We participate in meetings and work closely with them because we want to continue to advocate that what's being done in Bernalillo County should be replicated, because a lot of it is working well. And how do we partner and join forces to maximize and leverage that reach in the community?
Okay, thanks. So for now, if people notice something and they'd like to access help, do you recommend calling 311?
Yes. Yes.
Okay.
And if somebody has the access to behavioral health, it's often difficult when encountering somebody who's homeless to say, call New Mexico Crisis and Access line. But if it's a loved one or somebody that they know of that can call the Crisis and Access line, that is always a resource that's available as well.
Okay. Yeah, is there a section on our Bernalillo County Behavioral Health Services website that has a link to what the NMCAL, the Crisis and Access Line, is there a place for people to find out about that? Because I know that especially now, during the COVID pandemic, people are really struggling. I know this, I just know this as a person, as a therapist, that people are really struggling, and the NMCAL it has a crisis line for people who are feeling suicidal and in crisis. And it also has a warm line for people who just need to talk to somebody. So I hope there's somewhere where we can put the number for that up, or put a reference for that up, because it's important for people to know that there's 24-hour access to being able to speak with an actual caring human.
Absolutely.
Okay.
I think I will verify. I believe it's on there. If it's not, it'll be up very quick. But I think, again, the more opportunities we have to share that information, the better.
Okay. Joe, were there any more questions?
Yes, and just so so everyone knows, the NM crisis and access line, the number is 1855 NM crisis, 1855 NM crisis, or that's 1-855-662-7474.
That's great. Can you put the link in the comments section on Facebook? A link to NMCal?
Yes,
That would be great. Thank you.
And then we have another question from Rebecca Stover. And Rebecca says, it can be overwhelming for people to find care. Are there care coordinators or advocates who can help navigate the system and find appropriate care? A phone number as a starting place, maybe.
Yes. So we at the Department of Behavioral Health Services help with that. We have case managers and our community engagement specialists who can help folks get connected to services. So our department phone number is 468-1555, and that's kind of an easy way to get some of that information. Also, the New Mexico Crisis and Access Line helps to do that as well. So anytime you want to call the Crisis and Access Line, they can help get connected to services in the community. And they can do that across New Mexico. So if you have somebody in Rio Rancho, they can tell you what services are in that area, or in Las Cruces, services in that area. So that's a good resource that we should absolutely tap into.
Great. Thanks for the question. I have a lot just stored up. I've been writing them down as I remember them. Very common questions. One thing, Margarita, that I want to piggyback on when you were talking about our community kind of outreach efforts, and I'm thinking specifically in that Central and Tramway area in my district. I know you have done needle pickups, and that's a part of what behavioral health services does.
Absolutely. We used to do a needle pickup twice a month. With COVID, we stepped that down a little bit, and we're doing one once a month, and it just shuffles across town. We put information up on our Facebook and on our website for anyone to participate who is interested. Also, our website has information on our needle mapping services. So if you open your business and there's needles on the floor, you can map those, log on to that site and map those, and so it pings where they are. And that helps our needle pickup services are kind of tailored to where we're seeing a lot of those pings, so that we can reach the communities and the areas that are most impacted by those services. But this is something that we want to bring into the communities. We do little leagues and parks, and sometimes it's very obvious areas like alleyways, but sometimes not so much. And so if this is something that our department can help with, again, please feel free to reach out with us, use that needle mapping tool so that we can kind of tailor our pickups in that way.
Thanks. Yeah, and also I want to do a follow-up question about the mobile crisis teams. Can you talk just a little bit in a little more detail about that? Because I know that people in the community are really interested in how to maybe access a mobile crisis team if somebody is obviously having a behavioral health emergency. And I know it's a hard question, but people want to know, how many teams are there and how can we get more?
Sure. So right now, all of our mobile crisis teams are dispatched via the 911 system. So if someone is experiencing a crisis that they're needing an immediate response, we encourage them to call 911 for that. It's not uncommon for people to call 911 and request a mobile crisis team. And so that, again, is an option if you feel like you or your loved one is needing that help or that support in that way. We currently have 4 APD mobile crisis teams. We have 2 BCSO mobile crisis teams, and we're about to have 2 more BCFD mobile crisis teams. These teams are all covering at least 1 team 7 days a week. Our goal eventually is to have teams 24/7. Based on the current funding available for these services, those are kind of where we're capped out at right now. The hours are adjusted based on our highest call volume. So UNM ISR does an analysis of the calls that are received on our 911 dispatch, both in the city and the county. And based on that analysis, we schedule the teams on our peak call volumes of every day. So if we're having the most calls between 10 and 7 p.m., we need a team to cover that chunk of time. And they redo that analysis every 6 months to see if things shift. And if they do, our hours that the teams are staffed shift as well. And so again, if people are experiencing a crisis and they're needing a scene response, we encourage them to call 911 to be connected.
Thank you. Joe, anything else in the comment section?
I don't see any more questions right now. So, it's 6:30. I'm not sure we can go a little longer if you and Commissioner and Margarita have more to talk about. And otherwise, I think we're pretty much done with questions.
Okay. I just have a couple more that people ask me about, so I'd like Margarita to talk a little bit about them. First, Margarita, you mentioned the Gateway Center that the city of Albuquerque is working on, and how now it's really become a collaboration. I'm actually the vice chair of the Homelessness Coordinating Council, the HCC, and that's a partnership with the county, the city, and also UNM. And so I am a co-chair of the services, the Behavioral Health Services Committee. And I really think that as you've been watching this presentation, that Bernalillo County has really kind of come out as a leader in behavioral health services. And so, our mission in working with the city and UNM on these gateway centers is to provide this continuum of care that is not a revolving door of homelessness, but rather is a starting point wherever people need to start at to get into permanent independent living. Margarita, did you want to say any more about how the county is cooperating with that partnership?
Sure. Yeah, I'll just echo what you said, Commissioner. I think it has been the city's priority to really work on addressing homelessness, as it's been the county's priority to work on addressing behavioral health needs. And in saying that, there is a good amount of overlap. And so the county continues to advocate at the Homeless Coordinating Council meetings and the subcommittee meetings that just building a shelter is not an answer, right? We need to work on a full continuum, different trajectories of housing, and the supports for folks to be successful and not just be going from one shelter to another every night, but be successful in the long term and have a great quality of life. So as Commissioner Pyskoty mentioned, she's the vice chair of the Homeless Coordinating Council, and she's also the co-chair of the Services Committee. And so we will continue to advocate for that work and provide any supports that we can.
Yeah, thanks. And I also want to mention, because I also get questions about this too, with this model that we're looking at of smaller gateway centers, we are looking at having specialized facilities for our homeless veterans, for women with children, and also for youth. I know that those are special populations who have special needs out there. So we're really looking at, again, finding people, where they are, what they need, giving them what they need so they can become independently housed, permanently housed, and just, lead a good life. So that's our overall goal. I have one more question, Margarita, And so if anybody still has a question, they can put them in the comments while I ask Margarita about this. I know this from being a therapist, that there's been a gap with emergency room services and facilities, for short-term, long-term facilities for people with mental health issues. So can you talk a little bit about what's going on with UNMH and the Crisis Triage Center?
Sure. So as I mentioned, I think early in my slides, the county has provided a $30 million investment. That's a huge investment into a crisis triage center on the UNM footprint. Many years ago, when the discussion began about passing this tax and doing something different in Bernalillo County, a number of advocates pushed really hard in order to get a crisis triage center here, similar to models in Phoenix or Tucson and Chicago. And we felt that we needed to build a system first, as opposed to just building a big building and not just creating a new revolving door, but how do we have a continuum of services in the community that if someone goes to a crisis triage center, they can get their crisis addressed and then be plugged into those community supports, or be plugged into community supports on the front end so they never need the crisis triage center. And so again, that investment in the crisis triage center is something that is moving. There has been an executed MOU with Bernalillo County and University of New Mexico on that collaboration, and we are in the final stages of identifying a site. In order to launch that, we expect that this is going to move really quickly once we identify that site. The site right now is something that is just going to need renovation and not a full build out, and so that will help with the timing. Unfortunately, I can't say where in respect to kind of the vetting process, both on the county side and on the UNM side, but we're really excited about it and wanting to move forward on it. We know the services on the care campuses is helping to address some of those gaps, but the gaps are so stark. And we have to remember that crisis triage services, based on IMD regulations, Institute for Mental Disease, you can have a maximum of 16 patients in that area. So just a building that can serve 16 patients is not going to address all of our gaps. So we need different supports all over town, right? We want to push Presbyterian to look at starting a crisis triage unit. We want to look at Loveless and other sites to have crisis triage units that are maybe specialized, right? The VA may want a crisis triage unit that is specific for veterans. And we want to just look at how other partners in the community can provide supports in meeting those gaps, even in addition to what the county and UNM are working on.
Okay, thanks. And so, let's see. I felt like I had another question. Oh, no, I had a comment. I had a really good comment, which is this, that because we are building such a good system here, that I think that is really going to help us with our provider shortage, because, and especially with psychiatrists. I think that it's difficult. It has traditionally been difficult to attract, especially psychiatrists and mental health providers, because the system has been so ragged, just a non-system, and so it's not very attractive for behavioral health providers to come in if they don't have the right resources to refer to, facilities in the area. So yeah, I have a feeling that the way you and the department have gone about it, along with the city and UNM and other hospitals, and other service providers pulling together and really creating a system that providers are going to see this as a good place to work. And so that's going to help eliminate one of our big obstacles. Let's see, Joe, has anything come in?
Not any further questions. No, I think everyone asked their questions. So yeah, we can continue to chat and maybe wrap up.
Okay. And if anybody has any additional questions, just remember you can always reach out to my office. It's simply district5@burnco.gov. That's the best way to reach me. The email actually goes to me and to Joe Noriega at the same time, so you'll get a quick answer. And if it's something from Margarita, I can forward it, or you can send an email directly to Margarita. And so, Margarita, do you want to wrap up? I appreciate you doing this town hall. This has been great. I hope that people have learned a lot, and again, like you said, probably right after this, people will think of things, and so they can certainly get in touch with us.
Yeah. Thank you so much, Commissioner, for hosting this. We actually were planning and hoping to have town halls early when COVID hit, and so now we've just resolved ourselves to the virtual option, but glad to be able to do this. Again, just want to echo the same comments. We've been working to build a system here locally, and so we're excited to finally feel like we have some meat on the bones of it and some traction in some of that service delivery. I will say that it's the stories about the clients that access services that motivate us to continue to drive forward and do more. We had somebody come into our crisis stabilization unit who had been unhoused for 14 years. It turned out he was a veteran and who hadn't been connected to services. We had to help him get his honorable discharge paperwork, get an ID. He didn't have an ID, get enrolled in Medicaid, get enrolled in supports, and now he's been housed and stable for the last 6 months. And those are the stories, right? Those are the real things. We see all this data on the slides, we see all this information, but those are the things that pull on your heartstrings that say, this is why we do it, right? This is all this work, that's why we do it, so that people can be successful and we can get them connected to the support. So we're continuing to build services. We know there is remaining gaps. $20 million sounds like a lot of money, but in the grand scope of the gaps in the community, it's just a drop in the bucket of what we really need to do. So it's up to us to maximize those dollars, to advocate at the legislature for more supports and more funds, for ability to adjust reciprocity so we can get more providers into New Mexico and encourage those who are going to school here to stay. And it is, again, a longer, we're on a marathon right here. We're not on a sprint. This is a marathon that we're working to address these gaps. And thank you, Commissioner, for your leadership. We're really thankful that you're on the commission and our biggest cheerleader. And, you know, again, just want to reiterate that folks can access more information on our website, and feel free to email me. You have my contact information with any additional questions. I'm glad to do sidebar conversations. We actually had a conversation this morning with the behavioral health director in Missoula, Montana, who is looking to follow our model and implement attacks and build mobile crisis teams. And so we're sharing everything we have, and we're giving all of our lessons learned away so that you know, the country can help to address some of the issues that we're addressing here in Bernalillo County. So thank you again, Commissioner, for hosting us, and look forward to additional conversations in the future.
Yeah, thank you. And thanks to everybody who is watching this. I appreciate you. Thank you so much for caring. Take care. Bye.
Bye, everyone. Have a good night.